Hello, everyone. I'd like to welcome you all to yet another episode of the Journey to Healthcare. Today's episode is an interesting one because we're going to talk about physiotherapy, and not only physiotherapy, in particular orthopedic manual therapy. And today we have Ms. Banana Harbawi here with us. So would you like to introduce yourself, please?
Of course. So, hello everybody. My name is Banan Al-Gharbawi. I'm an orthopedic physiotherapist, certified manual orthopedic physiotherapist. I've graduated. I have a master's degree from Jordan, but yeah, I'm working here in Qatar in the International Center for Orthopedic and Neurosurgery. It's Icon Medical Center in Qatar.
Mm-hmm. So would you like to tell us first, what is physiotherapy?
Physiotherapy, that's a wide spectrum of definitions.
Mm-hmm.
Let's say physiotherapy is a progressive profession.
Mm-hmm.
In the days we were studying physiotherapy in bachelor degree when we were younger, they told us that physiotherapy, that's a way of treating patients and approaching the treatments as a conservative treatment. We use some physical agents. That's where we got the physiotherapy part. Physiotherapy had been there for histories. The Greek nation have been using physiotherapy, physical agents. I think they had some electric fishes that uses the wave of this to decrease the pain. They have been using some kind of exercises and stretches to the Greek patients there, but after that, we have been hearing records of physiotherapy in the pharaohs and and the Egyptology. Yes,
It was a very
actually,
long
I
way.
remember. Yeah, I remember something about that famous young king Tutankhamun.
Mm-hmm.
He used to have a scoliosis condition. That's one of the records we have. Yeah, it's an interesting story. He had scoliosis.
Mm-hmm.
So, in order to correct the scoliosis he had, they used to dress him up with the heavy metal chains. And to correct the scoliosis on the side, they used to have some kind of weight that actually helped him to correct it and be straight in front of his enemies, just for the image, you know. So physical therapy has been developing ever since. It has its wider profession since the World War II. That's where we get the people who had handicapped and cutting off the limbs. There where we had a real physical therapy profession.
Mm-hmm. So what is orthopedic manual therapy in particular?
Orthopedic manual therapy, it is a school.
Mm-hmm.
That's a school. When you go to physiotherapy, you have specializations, which is orthopedic, pediatric, gynecology. You go through a lot. Um, People who have been digging in a lot in the spine and in the joints, they understand what it means to have a movement, and they understand what it means to have movement restrictions. So when we say that I want to move patients with disc or patients with disc prolapse, that's when the disc herniation is affecting the nerve. So when I'm moving a patient who has a pain or a painful area, now we understand that it's not coming from the joint itself. It's actually a complex, let's say, a complex process that not only I am unable to move, my brain is also afraid to move. That it has the memory that this movement is painful. So in orthopedic manual therapy, we are getting the physiological movement, restoring the physiological movement through our hands, and then we are maintaining this movement throughout exercise.
Very interesting. So it's like more of a holistic approach, I could say.
It is, yeah.
Okay.
It is.
Yeah, go on.
Okay, so in orthopedic manual therapy, the one that I'm certified in, I have to shout out to Prime Physio in UK. They have been a huge help,
Mhm.
and they are the major. They had the major effect in my profession. I've been shifting my mindset and helping patients in really different ways since I joined them.
Mhm.
I used to get patients to rely on me, as don't move without me, don't try any exercises without me. After I joined the OMTAN, after I took this course, I realized that there is a hands-on in the manual therapy. There is a hands-on approach and there is a hands-off approach. So you
Mhm.
don't need me. You have just to understand how your pain goes, and you don't have to improve. That's what we are telling patients now. Your back and your chronic pain doesn't have to go 100%. In the long term, you can live your life and be functional.
Yeah.
See, this is what we are focusing on. That's a whole lot of schools are joined into this manual therapy approach. We have the Mulligan School, we have the Mackenzie School, we have the Midland School. They are all schools coming from each part of the world. So they are joined together to form the manual therapy certificate.
All right. So correct me if I'm wrong. So the path to become one is you go to get a bachelor's in physiotherapy, and then
Physiotherapy
later if you want to subspecialize, you could do a
and
master's,
orthopedic.
or how does that work?
Um, there is multiple paths to be a
Mhm.
certified orthopedic manual therapy. You
Mhm.
have to it depends on where you are, in which part of the world you are.
Mhm.
So I have been lucky enough to study in Egypt. I have my bachelor degree in Egypt. Then I was interested in orthopedics, so I worked with orthopedic patients. And then when I got the enough experience, I joined an extensive course that has several days, and then I took the exam. Then I became a certified orthopedic manual therapy. A lot of people don't have that access, and our country is like, I remember in Qatar, it's really challenging to
Mhm.
have this certificate. So in Saudi Arabia, it's accessible. In UAE, it's accessible. It depends on where you live, in which part of the world you live. So I got it in Egypt, and there is a lot of master classes you can go in, and master programs you can go in the UK and New Zealand, I think. So it depends on the accessibility of this program to you.
All right. So, question I ask everyone: why did you choose this field?
Well, I have been. Yeah, so this one, you could have, none of the physiotherapists believe me, um, but I've been wanting to be a physiotherapist ever since fourth grade.
Oh wow,
Uh, yeah.
that's
Now,
lovely.
my dad was a very active person. He
Mhm.
used to have two jobs. He used to be very passionate about his job, and then he had a disc prolapse. 4 days later, my mom too had a back pain and disc prolapse, and they both had sciatica. Then a week after, my youngest sister, she got Bell's palsy, so half of her face was not moving. This fear in our family that why they are not moving, they are not living their life. My sister stopped going to school. It was a lot to handle as a family at first, like the first shock you get. And then three of them are going to physiotherapy and coming back happier and feeling like a miracle just happened to their pain. And they're all like, oh my God, what would I do without physiotherapy? So ever since I saw how important it is, my sister, like we see doctors all over, and doctors are important, um, but they're not in detailed as physiotherapy in your life. Physiotherapy, they are going in detail how do you do your job? What kind of job do you have? What do you do inside your job? Do you hold a mouse? Is your mouse in right hand, or do you hold a hand in left handed? So we have to dig in into our physiotherapy program toward your specific goals. And that what happened with my mom and dad and my younger sister, and they are all living their lives now normally. So I have been wanting to be a physiotherapist ever since. And even though my dad, he's not happy for, he always wanted to be me to be a dentist, but I couldn't. It has to be physiotherapy. I'm a good physiotherapist, and that I think matches my personality.
Yeah, this is such a touching story, and I think,
Oh.
in my opinion, that it doesn't matter which field you go in, as long as you have a passion, you'll do
Yeah,
excellent at it. So yeah,
exactly. Yeah,
that's
exactly. I
fantastic.
think we match. Me and physiotherapy, we both have a love story now.
Yeah. Lovely. Okay, so what's a typical day like as a physiotherapist?
Um, well, actually, a typical orthopedic physiotherapy is an interesting day. We
Oh,
meet new people every day, and we meet the older patients we have. Let's say if I am meeting a new patient is walking into our clinic by referral from the orthopedic doctor.
mhm,
The orthopedic doctor will write for him like 12 sessions, 6 sessions, according to his diagnosis, and I will start to evaluate this patient. We will start evaluate this patient from pain side. We will know the intensity of the pain. We will know which is the grade. We will start to put numbers, translating the pain into numbers, translating the disability or the limited activities that he has into numbers. After we are done with the evaluation, we will start to set goals for the treatment. I will know what the patient wants and what I want from his treatment. For example, if I'm treating more of an advanced or an athletic patient, I want him to go back into his field. If I'm treating a patient with back pain since 10 years, I will tell him that okay, your pain might go down, but this is not what we're focusing on. We are focusing on how to limit this pain in 1 year to have less pain attacks. This all the talk with the patient for the first session is really important because it sets your mind on where you're going with your treatment plan. Because I have a lot of tools to use, but I want this specific tools to match this specific goal. And then we will start to implant the treatment program and to start to progress as long as the patient is getting better for the next session, the next session, the next session, then I'm going to progress the session. And then if I'm meeting an old patient, let's say an old patient that I know him and I know what I am implementing my treatment plan, let's say I will ask how he's doing, what if changes in his pain and his function now, and how he's improving, and if he's improving enough that I can progress more and more and implement more and more for exercise. If I am meeting a patient for the first time, I have to know what he does for a job and
mhm,
how this, let's say, injury has held him from doing his activity of daily living. This with the talk of his vision. If I have hesitations or I see a red flag or I see a yellow flag or anything in the examination process, I would definitely just pick the phone and call his doctor to have a talk about his condition and what am I going to help him with.
mhm. All right. So what's your favorite thing about the job?
There is my favorite thing in my job is my least favorite thing also in my job at the same time. I
Interesting.
like helping I like helping people getting better, but I don't like them to say goodbye to me. I want them to stay with me. I I I help people, and if physiotherapy has been there for a long time, I want people not to rely on me. I want them to understand that their pain and how it may be not as bad as it looks like. I don't want them to be dependent on medicine and opioid systems. These things that I don't want patients to be relying on their medications to help them with the pain. I would say that you have to understand how your body works and how this pain is coming. and how it's not limited to your condition. So I'm a different physiotherapy than the typical one, and these are here. I don't recommend something like cupping or acupuncture or dry needling unless I know for sure and for evidence based that this is going to help them. And this is what I'm trying to trying to implement in physiotherapy here, especially in our Middle Eastern world. I want the patient to know how this is going to help them. If it's not evidence based, if it's not recommended by the APTA, the American Physiotherapy Association, I wouldn't really advise the patient in it. This is not common, and we don't see a lot of physiotherapists do it, but I'm taking the responsibility to do it and to make patients understand that this is a different approach. This is the most helpful approach, and you will get better, but you will get better with a different mindset now about how your body works.
That's absolutely brilliant. And I think, like, if the patient understands what's going on, he or she is more likely to be compliant and more likely to even get motivated to get better and follow the instructions.
Yeah, it is in theory, but in medical practice, and having a lot of commercial advertisements
Yeah.
about what could be helpful, people, there are several types of people. People who are only interested on the short term to relieve the pain, like they only want this pain to go, and once the pain is gone, they will not never come back for physiotherapy sessions. But people who are focusing on the long term and the long term improvement, they will stick around and be more adherent to their exercise, and they will get how to help themselves. And these are actually the patients who will improve on the long term and will never have to do, let's say, surgical in the surgical approach. Now we have this term, the surgical approach, non-surgical approach, the conservative treatments. These medical terms are showing in the patient's face, and for patients who are now in pain, they only want to get rid of the pain throughout the machines. They will say, "Okay, now I'm in pain. You either massage me or you either put some electricity on me. If I'm in pain, there's some patients like this. If I'm in pain, I only want massage to relieve my pain, and then khalas, go away." And that's not what we do. And please, if you're a patient going to physiotherapist, please don't tell them this. We are going to help you, and exercise, it's not an all it's not how it seems it's going to help the pain, but this will treat the cause of the pain, that your pain will never come back.
Mm-hmm. Right. So,
Okay.
to sum it up, what advice would you give someone who's aspiring to be a physiotherapist?
I would say don't do it unless you are ready to face it.
Yeah.
It's a challenging profession. It's challenging to have all the optimum and positivity in facing patients. It's really hard, especially here, because the community isn't helping us. And it's not about what the machines you are using with the patient. It's not about taking the courses. It's about how you are going to help the patient. I would say to people who, I've been working with students in physiotherapy for 2 years. I've been teaching in physiotherapy. So I always tell the students, you need the patient. The patient is not that much needing you. There are a lot of physiotherapists in the world. You have to be one special physiotherapy to make a difference in patient's life. I would say to people who are trying to be a physiotherapist that it's not an easy. You will not graduate and see the people trying to hold you. Oh, come work with us. It's not like that. You have to have to get in touch with the most recent evidence. You have to learn how to read the APTA guidelines. You have to know how to help patients, not only commercial way, but also to focus on the patient's needs and to communicate with patients.
All right. So it was such a pleasure having you here with us. I learned quite a lot
Thank
about
you.
the field.
Thank you.
And yeah,
It
so
was a mutual pleasure, actually, and I'm thanking you for doing this interesting series. I really loved it.
thank you. I appreciate it.
Thank you.
All right.
Thank you, Yuma. Okay.